CNN reports. An outbreak of infections linked to McDonald's Quarter Pounders has a lot of people across the United States concerned about their exposure to dangerous E. coli bacteria. Welcome to Channel Health and Alerts. Amid McDonald's linked E. coli outbreak, here are symptoms to watch for and ways to stay safe. Federal health officials are investigating a multistate outbreak of E. coli infections linked to McDonald's Quarter Pounders. It is not yet known which specific food ingredient in the burgers has been contaminated, but as of Tuesday, dozens of people have gotten sick with E. coli infections, including one death, in at least 10 states, according to the U.S. Centers for Disease Control and Prevention. The type of bacteria that has been implicated in this outbreak is E. coli O157H7. With this particular type of E. coli that has been in the news, it's called O157H7. The most vulnerable groups tend to be elderly adults and very young children. Although E. coli is very common and can cause a number of health problems, including urinary tract infections and stomach flu. This particular strain mainly causes gastrointestinal symptoms, including abdominal cramps, vomiting, and most importantly, painful diarrhea that at times can become bloody. Some people can also develop fever and eventually become dehydrated from not eating or drinking much while having diarrhea. The good news is that, although at times it can be severe, most people with E. coli O157H7 recover on their own. McDonald's customers are encouraged to get medical care if they ate a Quarter Pounder and developed symptoms of E. coli infection. E. coli, or Escherichia coli, is a common type of bacteria that lives in the intestines of people and animals, but some E. coli can make people sick. People can get infected after swallowing E. coli from contaminated food or water, or through contact with animals, environments, or other people where the bacteria are present. Also, it occurs in clusters that might be around a particular exposure or a particular risk, and that may happen maybe every few years. According to the U.S. Food and Drug Administration, people infected with harmful E. coli can start to notice symptoms a few days to as many as 9 days after exposure to the bacteria. A person can be tested for the presence of E. coli in their stool. Symptoms of infection include diarrhea, especially lasting for more than 3 days, and a fever higher than 102 degrees Fahrenheit. Some people may also have severe stomach cramps and vomiting. Most healthy people may not develop symptoms, but, for the most part, the symptoms that people should be on the lookout for is diarrhea. The severe kinds of diarrhea that come from E. coli can often start with a loose stool, a watery kind of diarrhea, but it will occasionally then progress to bloody diarrhea. Most people recover without treatment after about a week, but some may develop serious health problems and need to be hospitalized. There is a particular kind of E. coli known as Shiga toxin-producing E. coli, or STEC, that has been implicated in serious foodborne illness outbreaks. Exposed individuals could get bloody diarrhea and even kidney failure. The CDC estimates that there are about 265,000 infections with Shiga toxin-producing E. coli in the United States each year. Treatment consists of supportive care for symptoms and fluids for hydration. Infection with STEC can lead to a serious health condition called hemolytic uremic syndrome, in which kidney failure may occur, or even death. And O157H7 is one of these types of bacteria. For the initial phases of E. coli infection, with diarrhea, hydration is the most important treatment. So, infected individuals should drink plenty of fluids if they can tolerate it. Children are at most risk of dehydration, and products such as Pedialyte are often recommended in this situation. Sometimes patients need IV hydration at a medical facility when they are more severely dehydrated. For E. coli 0157H7, antibiotics are controversial and are generally not recommended based on some evidence that they can actually increase the risk of hemolytic uremic syndrome. The CDC warns against using antibiotics with stec infections for this reason. The other thing that we really are careful about with this is that sometimes there are medicines that people take to slow down their bowels when they have diarrhea, and those medicines are not recommended. The idea is that you maybe don't want to keep the bacteria and the toxin in. Maybe it's better to have the diarrhea. So people should always consult their physician before taking any anti-diarrheal medicines if they're worried that they have an E. coli infection. How to prevent E. coli infection? According to the CDC, the best ways to prevent E. coli infections are to keep your hands clean by washing them frequently, prepare food safely, and drink safe water. Undercooking meat is a common and serious problem. Infectious organisms may not be killed at lower temperatures. Thoroughly cooking meat to an internal temperature of 160 degrees Fahrenheit throughout kills E. coli 0157H7, according to the US Department of Agriculture. Another way to prevent illness is to thoroughly wash vegetables and fruits before using them. Even if you are going to peel them, you should wash them first under running water. It's not necessary or advisable to use soap, dishwashing liquid, disinfectants, or other solutions. Be aware of what containers and utensils are in contact with raw meat. Do not put salad items or cooked meat into these containers. Also, do not wash other uncooked meat or raw seafood in your sink. That could spread bacteria, and you could inadvertently contaminate other food. The CDC also notes that choosing pasteurized milk and juices can reduce the risk of E. coli exposure because the pasteurization process kills harmful germs, including E. coli. Take care and share to care. A well-informed person is more likely to survive longer and have a better quality of life than an uninformed one. Reset Health. Reset Life. Catch you in the next Health and Alerts update. Catch.